from the station that's on your side. This is Channel 7 News Daybreak.
Hey, welcome back into Channel 7 Daybreak. Today is Wellness Wednesday, and we're talking with Dr. John Allen Cockerell today about the importance of visiting your primary care physician. Dr. Cockerell, thanks for joining us. I know that this is something that primary care physicians, doctors all across the country are trying to get across to their patients. How many things have been missed in the last year in terms of early screening? I know there's 4 different things we're going to touch on today, but let's touch on the most important one first if we can. Early detection. I know that's got to be number 1 on your list of the importance of why coming to see doctors like you should be on everyone's calendar.
I certainly think so. Biased as a primary care doc. What some people don't realize is that part of our title as it is preventative care. So we are preventative care physicians, not just primary care. So to your point, we want to get out ahead of stuff. There are guidelines and recommendations, not just from me or my colleagues or other doctors, but from organizations that give us, research-backed items to go over with patients, things such as colonoscopy. For women, mammogram, pap smears, those are some of the basic ones, but there's also specific labs that we can check, things that have been research proven to be effective if screened the proper way in one of the preventative wellness visits like you're mentioning, right, to prevent disease in the future. So it's really critical that we don't just become reactive once you get sick or once you have a problem. We want to be proactive on the other end of it, try to, the best we can, get ahead of things.
Talk about the importance. Why is it so important to find a primary care physician specifically for an individual and go to them regularly?
A couple of reasons. One, not to be financial advisor on here, but you'd be surprised through most insurance companies that these visits are free. So to help your pocketbook there, this is something that is covered by the vast majority of insurers, because they also see the value of preventative care, right, on your behalf. So not only that, but some give discounts for premiums and things of that nature. So there's a financial incentive built in sometimes as well. On a health note, of course, it's those screenings that we mentioned, but we want to get to know you. We want to know your medical history. So again, if you do get sick, we have a basis to work from. We know kind of who you are and at least, some idea of what's going on for you, so that we can have the continuity. And that's something that I really am passionate about, is the continuity of care, not just one-off visits or doing things, quickly, but really spending time with folks, getting to know their medical history so that maybe the next time they come back, where they were at that point, some history there, and it matters for continuity.
And planning that action from that point, I know, is the 4th point you wanted to make here. We don't have much more time left, but I do want to mention to everybody that if you would like to schedule an annual physical, go in, see your primary care physician. You can do so anytime going to baptist-health.com. Call the number on your screen as well. Dr. Cockerell?
Thank you so much. Can I say one more thing?
Absolutely.
I'm sorry, I'm pressed for time here. So I would be remiss, and yes, I believe in preventative care, absolutely. One of the preventative care measures that we look at are vaccines. So I feel as though I'd be remiss to come on here, and ignore the pandemic around us. I would just give everyone out there listening just an opportunity to maybe rethink the COVID shot if you haven't taken that yet. Again, I know there's things on both sides of this discussion. Certainly, we want to be sensitive to those things, but we also want to protect as many folks as we can. So just a plug here at the end is a preventative care physician, really, no matter where you've been with this or what your thoughts have been in regards to it, please reconsider if you're unvaccinated, because this is something that primary care docs and other docs too can offer most of the time at a free service as well. So please consider that, rethink that. If you have questions, please talk to your healthcare provider.
All right, Dr. Cockerell, thank you again.